Welcome to Epg Pathshala. I will be presenting the module on social determinants of mental health, which is part of the course on mental health in the subject of social work. The writer of this module is Dr. Ramesh, who is a faculty at Banyan based in Chennai. I am Vimla Nadkarni, retired professor from Tata Institute of Social Sciences and the immediate past president of the International Association of Schools of Social Work. We will start with the objectives of the session, go on to the content and take each point, elaborate on it, as well as, and then end with the summary of this module. So the objectives of the session, of this module are facilitate understanding of key concepts in health, mental health and social determinants of mental health. So we will begin with giving you an understanding of the key concepts. Then we'll go on to discussing the importance of social determinants of mental health. So you should understand why are social determinants of mental health important. The third objective is to share the strategies employed in assessing and addressing the social determinants of mental health, and also to try and understand how you will integrate this knowledge in your practice as social workers. So let us look at the mental health scenario globally and with some aspects of India, of the Indian scene. Mental disorders result in a loss of 13% of disability adjusted life years. 4 years lived with disability, which means that those who are suffering from mental disorders are disabled in a way. They are mentally challenged, or they are disabled, and they lose 13% of their years to living with mental health disorder, with this kind of disability. And this affects the global economic scenario, because the global economic burden of non-communicable diseases report by the World Economic Forum in 2011 says between 2011 and 2030, $16,000 billion worth of cumulative economic output will be lost only due to mental disorders. So you can imagine what a great burden on the economy of the world mental disorders have. And the treatment gap among persons with mental disorders is 76 to 85% for low and middle income countries, reflecting that people who suffer from mental disorders do not access treatment, or they do not have access to treatment. So what do we understand by health and mental health? You are probably familiar with the definition given by the World Health Organization, where health is defined as a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. I would add here spiritual well-being, because that makes health a holistic phenomenon. And mental health is also defined by WHO as a state of well-being in which every person realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her or his community. There are two experts. You have heard of Amartya Sen and Martha Nussbaum, who have also looked at these concepts. Amartya Sen has developed what is called the capability approach, which includes being adequately nourished, free from avoidable disease, and able to take part in the life of the community and having self-respect. So, individuals who do not suffer from mental illness, who are the so-called normal individuals, they have capacities because they are able to get proper nutrition, they do not have disease, and they are also able to participate in their communities and enjoy self-respect, dignity and worth. Martha Nussbaum extends this further by including not dying prematurely, good health, bodily integrity, use the senses to imagine, think and reason, freedom of emotional expression, practical reasoning, enabling planning of one's life, affiliation with others in conditions that engender self-respect, and non-discrimination, concern for other species, and being able to laugh, pray, enjoy recreational activities, and participating in community and neighborhood life. So here you see that she has further elaborated on the concept, on the capability approach, and what is important here to note is that she also includes concern for other species, so concern for the environment. And she goes into greater detail about the person, not only the physical aspects of the person, but also the psychological and the emotional and intellectual life of the person, as well as the social relationships. She emphasizes on the importance of social relationships that encourage self-respect and that are non-discriminatory. So what do we mean by determinants of mental health? These are factors which cause, influence, trigger, aggravate and impact mental health. So mental health of an individual is an outcome of the interplay between psychological, biological and social environments. The biological and the physical include genetic factors, people experiencing chemical imbalances in the brain due to various reasons, as well as personality factors. So a person who may be an introvert, person who is an extrovert, so there may be different personality types also that help us in the understanding of mental health of an individual. The environments that affect the individual include the birth and growth of the individual. So, under what circumstances is the individual born? What kind of care is given to the individual? What prenatal and postnatal care has been provided, has the mother of the child, given birth in an institutional setup or at home, and how has the child grown? So what has the environment been for encouraging the physical and psychological growth of the individual, as well as access to education and work. And we have in low-income countries, in countries like India, where a large part of the population is still poor, and children living in remote rural areas who may not have access to proper education, or children who are forced, because of poverty, they are forced to work along with their parents, and therefore they are not able to go to school and have a facility to get educated. So in this kind of environment, the mental health of the individual, not that it is necessarily going to be negative, but there are chances that education helps in enhancing knowledge, in enhancing coping capacities, in providing life skills. So children who are forced to work in an early age may learn different kinds of life skills. The work environment also affects the individual. What kind of work environment is it? How hygienic are the conditions of work? Is there access to water and sanitation? So all these factors would affect the individual, and how the person leads how people lead their life, how do they age and death. So the environment that affects the individual from the cradle to the end, when they are dying, that affects mental health. And the differences around them are in terms of the kind of place, as I pointed out earlier, whether they are living in the urban areas, rural areas, semi-urban, in towns, cities, mega cities, the people they interact with, and the kind of earnings that they have, whether they have enough purchasing power to lead a comfortable life, to get proper nutrition, to get proper education, and access the resources, whether they are social services or other basic resources that they need to lead a normal life with a sense of well-being and health. Especially in the Indian context, we need to understand the contextual factors, and among them, the very important ones are gender. There is a difference between how women respond and men respond, how women are socialized, how girls are socialized, how boys are socialized. There are differences in the way they are socialized, especially if we look at our patriarchal society, where the boy is given more importance than the girl. If a girl is born, the family is very sad and they want to get rid of the girl. Or they will keep trying till they get a boy, because of the belief that the boy is more important, the boy will earn and look after the parents and will also carry the lamp at the time of the death of the parents. So these are factors that are important, that need to be considered. Then there's gender violence, there are issues of sexuality which also come in. Religion, caste. Caste is a major factor in our country, where the lower caste, the Dalit people are always exploited, and even if they want to progress, they are put down by the upper caste, and this continues in our country and affects mental health of the people. The culture is also important, and besides the micro level determinants, there are macro level determinants. So the extent of the population, what kind of population is there in the number of people that we are living among, the characteristics of the population, and how resourceful is that population. Are we able to utilize the capacity of the people, the numbers of people, their access to resources, to mental health resources, the language, the geography, the infrastructure. There is even status related to language. Today, for example, those who do not speak English, they are looked down upon, whereas, and those who speak only the regional language. So these are factors that also have to be considered, the macro level factors. Whether they live in a mountainous region, they live in the plains, then their access to finances, the whole budgeting of for health and mental health, the kind of governance. So government programs, their policies, their legislation, to what extent are they positively related to the development of mental health programs and the implementation of the programs. The other macro level determinants include stigma, discrimination, neglect and marginalization, as well as life expectancy. We'll take some of these in more detail. So micro level determinants, as mentioned earlier, the life course covers period from cradle to the grave, with gender playing a major role, and parents, families, housing, parenting, wealth generation, access to resources, parent and family environment, all these are micro level determinants of mental health. So from the individual, we are going to the family and looking at issues of how a child is brought up, whether there is enough access to resources, what is the family environment like, and then the neighborhood and community relationships, the participation, safety in the community, the resources that are available in the community, the support that is available. So if there is an accident, or if would people come around and help, if there is a fire, or if there is any such crisis, there are disasters, how do people come together? Then what is the level of violence in the community, crime, and also the biological and natural environment also are important. The pollution in the environment in which one lives, that affects health and mental health. And studies link depression and anxiety with the social isolation of the elderly, unemployment of youth, less wealth, lack of social support, and low educational outcomes. If we look at the statistics, 10.6% Indians are affected by a mental disorder, and there is a prevalence of 18.4% in the age group 40 to 49 years. So look at the largeness of the population affected and the very minuscule response in terms of services. Only 0.6 mental health workers, we have only 0.6 mental health workers for every 1 lakh population, and less than 5,000 psychiatrists. There are 20,000 psychiatric beds in less than 50 mental hospitals. And of course, it's the government that provides more services, mental health services, than the private sector. So you see here the very low importance given to mental health in terms of availability of services for those who have mental illness, or even for the prevention of mental illness and promotion of mental health. Mental hospitals alone consume 67% of funds. Rupees 16 per capita is spent in lower middle income countries, whereas the global average is 130. And high income countries spend close to 3,000. So you see the big variation in the kind of spending on mental health services. As already mentioned earlier, that low socioeconomic status is associated with increased rate of depression. So poverty is related to low status, low mental health status. And 90% of persons with severe mental illness are unemployed. So this is a reflection of how these factors affect at the macro level mental health status of the public. In what way has the government responded? What are the legislations that we have? Of course, we do not have time to go into detail, but the Mental Health Act was passed only in 2017, and this is in compliance to the human rights covenants, the Conventions on Human Rights of the world bodies like the United Nations. There is a difference in coverage of mental health programs in our states, in our country. So it is not uniform. For example, in Kerala, the coverage of district level mental health programs is 100%, while in Punjab it is only 13.6%, and we are aware of the very high levels of drug abuse in Punjab, which are related to mental health, which reflect the mental health status of the young people in Punjab and shows the need for more services. We need laws that facilitate access to shelter, healthcare, education, employment and social protection for all. And all these laws would have a positive outcome on mental health. Another major factor at the macro level is the stigma, discrimination and marginalization that people with mental disorders experience. So Indians with mental health issues experience increased stigma, discrimination, neglect and marginalization compared to people with physical health issues, though of course there are certain diseases like tuberculosis, cancer, HIV and AIDS that do, have stigma attached to them, a lot of stigma attached to them. People living with leprosy, though these cases are supposed to be much less, but they are also suffering from issues of stigma and discrimination. However, mental health related stigma is found at a personal, family, institutional, community and society levels. Mental health caregivers, staff and professionals also experience stigma. So it's not only the individual who is mentally ill who experiences stigma, but all the people in the immediate environment and even the caretakers experience stigma. So they are looked down upon because there are so many myths and misconceptions related to mental illness in our country. 17 crore Indians use tobacco. Majority are male, rural, tribal, poor and middle-aged. So this is related to substance abuse, and alcohol use is more among males in urban, non-metros, working population and less educated. And overall there is poor access to treatment of mental illness, welfare schemes, employment and education. What is the life expectancy and gender issues at the macro level? Women live for 3 years more than men, and between the ages of 15 and 60, 21.6% more men die than women. Women are also more at risk for suicide. They suffer twice as much from stress and neurotic disorders than men. So women do need a lot of services to prevent mental disorders. They need access to preventive care, promotion and rehabilitation. We'll now come to the strategies for assessment and understanding impact of the social determinants, which cover the areas of promotion, protection, care, treatment, and also WHO's comprehensive action plan. We'll take these each one in detail. So promotion of mental health means a healthy lifestyle with better living environment and respect to human, civil, political, cultural and health rights. It also refers to safety and security for citizens and mainstreaming of mental health care into all policies and programs. The preventive strategies include interventions at early childhood through home visits for pregnant women and institutional delivery, integrated child development schemes with psychosocial activities, nutritional supplements, counseling and guidance for special groups. So children who have physical disability or who are mentally challenged would need these special services. Prevention also includes life skill building support to children and adolescents. So teaching of life skills like communication, coping, relationships with the opposite sex, and many other aspects for leading a life of well-being and mental health. Interventions also include youth centered projects and women's empowerment programs. Institutional level interventions at the college and school level. So we have programs to prevent drug use, drug abuse, alcoholism and life skills. Work environment to be stress-free, so creating an enabling environment which is free of stress, prevention or reduction of violence, free or subsidized housing projects, rural, tribal, slum community development, poverty alleviation and social protection programs for the poor. Prevention also covers strategies like advocacy for anti-discrimination laws and campaigns, and ban or prohibition or restriction or increased pricing or taxation on substance abuse. Of course, there is a lot of ban on drinking in several of the states in our country, and of course it has become a controversial issue, especially some of the laws that have been passed, which probably you are aware of. Prevention of child-specific disorders and dementia prevention among elderly. These are all part of the prevention strategies. The care strategies include promoting rights, opportunities and care of individuals with mental disorders, providing psychosocial support for people with mental illness, and providing support to the families, caregivers and collaterals, including the parents, partners, children, siblings and other dependents of people with mental illness. So not only the people suffering from mental illness need support, but their caregivers within the family, within the extended family, even counselors would need support so that they do not burn out. And burnout issues are dealt with. The treatment strategies cover de-addiction initiatives, very important, especially in those areas, parts of the country where drug abuse is common. Developing cost-effective, resource-efficient, feasible and flexible interventions. Providing pharmacotherapy for epilepsy and psychosis. I think you're all familiar with what is epilepsy and psychosis. That is a more extreme condition of mental illness. The Comprehensive Mental Health Action Plan includes contribution towards global targets, strengthening effective leadership and governance at the country level, providing for a comprehensive, integrative and responsive mental health and social care services in community-based settings. It's important to strengthen information systems. So the action plan would also include information systems, evidence and research. So studies that have shown the relationship between poverty and mental health, they are important to influence what governments will do to reduce poverty and to enhance mental health. The action plan also includes care by trained non-specialists to identify and manage mental health conditions, and a life course approach to tackling inequalities in health, which means that gender issues have to be tackled and health services have to be provided for all. So whether people are poor or rich, especially those that are marginalized and vulnerable, need to be included in the services, as well as the poorest of the poor not to be neglected. And what is interesting here is that non-specialists could be trained, and this was part of the National Mental Health Program in the 70s in India, where community people were trained to identify mental health conditions in their own communities and make referrals to the health center and to the hospitals. So we come to the end of this module, and to summarize, I repeat that human well-being and health are fundamental to mental health. Our life stages will comprise of different factors, characteristics and environment of physical, social, cultural, economic, educational, occupational and political variables, and these variables impact mental health both positively and negatively. The magnitude and nature also vary from time to time. Social variables play a major role in terms of inequality as they increase the vulnerability and risk for mental ill health. The strategies to assess and address the social determinants of mental health need to be included in mental health care service management and delivery. Students, you can learn more from the e-text and the references that are attached at the end. Wish you all the best and thank you for your patient listening.